So why I like to really talk about breathwork is it's an incredibly versatile tool and it's very effective for what I see as the kind of main issues that we're facing, as a collective today. Things that revolve around stress-related dysfunction, anxiety and panic, chronic pain, chronic fatigue, issues with emotional regulation, focus and attention, these less objective, less classified, right, aspects where a lot of people are challenged. And unfortunately, the way that the traditional Western medical system is set up, it is not effective at dealing with a lot of these issues. I'm a physiotherapist. I've been a physio for a decade, and I just kept coming up against this idea that the skills that I was given didn't really equip me to help my clients with the challenges that they're actually coming to me with, right? Yes, I could help someone in pain, but I find it was intimately tied to their emotional state. And yes, I could help with someone that's struggling with, an injury, but when we got into it, it really came back to the stress levels that they're under or their emotional dysregulation or a fight with their partner. And so I was on this kind of quest of like, what makes me a better physio? And it's not more manual therapy. It's not more exercise prescription. It's not bettering my hands-on skills. It was starting to understand, well, what are the actual challenges that my patients are facing? And so that kind of led me down this path probably about 6 or 7 years ago of just kind of diving into breathwork. And I first pursued it as this, like, this seems cool, right? It's like this trendy tool. And I came to understand it's really the foundation of health. And if you asked me 10 years ago, I would not have said breathing. It's not something I was taught as a physiotherapist, right? We did one lecture on the diaphragm in 5 years of school, and it was on neurological injuries, right? It wasn't on the role that breathing plays on our emotional state, on our energy production, on our waste management, on our posture, on our mood. And so where I've kind of found these worlds colliding is understanding that dysfunctional breathing is a huge issue that not a lot of people are talking about. And when we correct breathing, what happens? So today, my goal is to really help you understand why so many people have dysfunctional breathing, right? This is a relatively new phenomenon where we're seeing so much dysfunction in breathing. How does it show up? Because the tricky thing about breathing is no one comes and says, I've got an issue with my breathing, right? The impact of dysfunctional breathing often shows up as stress or anxiety or pain or energy issues or emotional distress, right? So it's not that people are aware of like, these issues that I'm facing may well be tied back to the way that I'm breathing. And then the final thing is like, what can we do about it? How can we actually start to treat, for lack of a better term, dysfunctional breathing and help people restore this natural balance of the body? Because one thing I really want to drive home is health is the natural state of the body. It's really this disruption of our innate balance that causes so much of this disease and disorder and dysfunction that we see. But the body is meant to be healthy. If under the right conditions, the body produces and generates health. So why do so many people have such poor health? Well, that's what we're going to kind of talk about today. Dysfunctional breathing is honestly, it's a bit of a silent epidemic in my mind. I, as a practitioner in this field, was really unaware of how much dysfunctional breathing we actually see. And unfortunately, those numbers are getting bigger and bigger, and we're noticing it earlier and earlier. We can talk a little bit about some of the changes to lifestyle and behavior and what's happening with adaptation and evolution. But breathwork seems to be, in my mind, this missing piece when we're looking at what I call the big four problems, right? Stress, anxiety, pain, and energy or fatigue. And so when you think about those problems, whether you're a massage therapist, a yoga teacher, a health coach, a doctor, a dentist, it doesn't matter. A lot of your clients will struggle with stress, right? They experience anxiety, they may deal with pain, and they may have issues with their energy. And so I was always on this quest of understanding, well, what tool can I share with my community or with my clients and patients that are going to help with these actual problems rather than just manage the symptoms that they're presenting with? Dysfunctional breathing, right, is, when I say linked, we could call linked, associated. There is some causation, right? We can see these really strong relationships, but the big areas that I see a lot of dysfunctional breathing is leading to chronic neck and back pain, stress, anxiety, panic disorder, issues with sleep, issues with attention, learning, and memory, asthma, hypertension, and chronic fatigue. And today I hope to just kind of like unpack a little bit more about why that link is there. I want to, before we kind of dive into this specific mechanism, introduce this concept that most people aren't aware of. I learned this as a physio, but it's incredibly important that the body kind of adapts to what we do consistently and frequently. You sit on the couch every day, you get better at sitting on the couch, right? Certain muscles shorten, certain muscles lengthen, your posture actually adapts because your body is always striving for efficiency. And so this concept of when we put our body in a certain position frequently, my body learns to get better at that position. And why I'm explaining this is really important. The body doesn't choose the best option, it chooses the easiest option, right? Like underneath everything, if we go down to the kind of core base layer, the body really wants, or the nervous system wants to conserve energy, right? So it will not choose the optimal, right? It will choose the easiest. And so what I want everyone to consider is what position are we putting ourselves in, or what position is culture and society and, you know, the population at large putting themselves in that is causing this disruption of breathing. It's our phones and our laptops, right? This is pretty recent research that shows the average, right? This is not the maximum, this is the average time that people spend on their phone is 4.5 hours a day. And if you look at that little image of the cartoon, right, like sit on the train, sit on the bus, go to a grocery market, watch people, how do they use their phone, right? It's in their lap, head down. Recent researchers show that time on a smartphone, right, can actually reduce lung capacity by up to 30%. Lung capacity is one of the greatest predictors of longevity. So we're doing this thing 4, 5, 6 hours a day that greatly reduces our lung capacity, which is a huge driver of our health, of the state of our nervous system, right? Even if you're very intentional about your phone usage, how much time do you spend sitting in a chair? Even if you don't have a desk job, do you drive to and from work? Do you sit down to eat your meals? Do you watch a little bit of TV every day? Like the average sitting time is upwards of around 8 hours for most people, right? And so it's not just the phone, it's also, we never have sat as much as we do today. And when you understand the biomechanics that sitting actually changes the orientation of the rib cage and the pelvis. It makes it harder for me actually to use my diaphragm. And the diaphragm is this kind of center of the universe for the body. When we start to interrupt how that muscle works, well, that impacts my digestion. That impacts my blood flow. That impacts my lymphatic system. That impacts my posture, right? So it's not just me saying that like putting yourself in a bad position just makes it harder for you to breathe and that's where the buck stops, right? No, there's this downstream effect of when we begin to interrupt or impact breathing, we impact everything else. And that's the real takeaway I want you to have from today is that this is less about breathing and it's more about the impact that breathing has on my nervous system, on the physiology and the functioning of my body, on my stress response, right? On my emotional state. When we start to understand that, what I call relational thinking, the relationship between my breathing and my anxiety, the relationship between my breathing and my energy, that's where we start to be like, oh, this is a big problem, right? A really big problem that not enough people are talking about. Hence, why you're here on this webinar. So when we understand that a change in someone's posture causes a change in their breathing, and a change in breathing impacts everything else. And I don't say everything else just as a throwaway term. I really mean that, right? There is no system in the body that isn't impacted by breathing. The first thing we do when we are born into this world is breathe, and the last thing we do before we depart is breathe. And life is but a series of inhales and exhales between those 2 points, right? It's something you do 22,000 times a day, whether you're paying attention to it or not. But just because something is automatic does not mean you're doing it optimally, right? And that's where I think a lot of people go, breathing, you know, it's like, what's the big deal? It's happening in the background. There's nothing I need to worry about. But the same way you can pick up any bad habits, right? Because of your posture and because of what we'll talk about in terms of lifestyle, your breathing can start to become a problem, right? That perpetuates a lot of the symptoms that people experience. I'm not saying breathing is the cause of all the woes in the world, but I am saying that it's an incredibly important aspect of what we call health, right? And what we call disease. There is no disease or dysfunction that isn't worsened by dysfunctional breathing. And the reverse of that statement is also true. There is no disease or dysfunction that isn't improved when we improve breathing. Because when we look to the role that breathing plays for things like energy production, right? We start to understand the gravity of that statement, right? And I just want to repeat it again, right? There is no disease or dysfunction that isn't worsened when someone breathes poorly. Like we see this relationship between dysfunctional breathing and a lot of pathology. And vice versa, when we start to correct this driver of health, lo and behold, a lot of symptoms, right, that can be attributed to this disruption of my innate balance start to get a little bit better. So the first kind of driver that I want everyone to be aware of, right, is that posture impacts breathing. If someone is spending hours on their phone, their breathing is going to be impacted. If they're spending hours sitting at a desk, their breathing is going to be impacted, right? The question is, are they doing anything to mitigate that? What I'm not saying is throw away your phone and throw away your desk, right? Like the cat's out of the bag in terms of technology. We have these devices, use them hopefully with intention. What I want you to understand is that if we don't mitigate, right, and push back on some of the impacts that phone usage, that sat at a desk has on my breathing, then it is going to continue to decline. And the worse that someone's breathing gets, the worse that everything else gets. So what is this second big driver of dysfunctional breathing? To understand that, we have to understand this relationship, right? How we feel influences how we breathe. How we breathe influences how we feel. You do not need me to tell you this, right? What do you do when you're really frustrated? Right? That's sigh of frustration. What do you do when you're really tired? Right? Like you're not intentionally like, oh, I'm going to do a yawn now, right? The way that you feel is dictating a change in your respiration. But vice versa, right? I can make you breathe a way right now that is going to create a feeling of anxiety in your body. And I know how to do that, right? Because your breathing is informing your nervous system. If you start breathing up into your chest, you breathe with your mouth, you breathe shallow and you breathe quickly, in a very short space of time, for most of you about 15 seconds, you'll start to feel what you call anxiety or panic. Why? Well, your breathing is informing your nervous system how you should be feeling. For almost all of evolution, right, our breathing only ever changed in relationship to the environment. I'm running away from the tiger, right? But now we can change our breath, right? We have volitional control. I can breathe quickly, I can breathe slowly. I can breathe deep, I can breathe shallow. When we understand that, it gives us this beautiful inroad into informing my nervous system about the state of the world. Because unfortunately, the way that the environment is set up now, right, most of the information that your nervous system receives is that the world is a scary place. Because you sit at a desk and you breathe shallow, right? Or that you're constantly stimulated by social media and you got the dopamine fix early in the morning, your lighting environment is terrible at night. Like all of this stuff that starts to disrupt the nervous system. I can start to change, right, the information that my nervous system perceives via this input that is breathing. This is not to turn this into a downer, but you don't need to be a statistician. You don't need to be a data analyst to look at the trends in these graphs. These are looking at rates of anxiety, depression, chronic stress, and chronic fatigue. Look where we're going, right? Like, and I'm an eternal optimist, but numbers don't lie, right? Like we're facing unprecedented levels of stress-related dysfunction, anxiety, depression, suicide, right? Self-harm in particularly young girls. Like, and this has just been accelerating from about 2008. There's a few theories out there as to why, I really disagree with this, like, oh, well, we're just, we're identifying it more because we've got better at identifying it. It's like, that seems like a little bit of a sweep it under the rug mentality in my mind. 2008, we got the first front-facing camera on our iPhones and Instagram came out, right? So we see this skyrocketing rates, particularly of adolescent anxiety, of this self-comparison, of this change in my dopamine circuits, of this constant stimulus to my nervous system. But these aren't just affecting adolescents, right? We're seeing there's been a 25% increase in generalized anxiety disorder since COVID. We've seen depressive rates go up. Stress-related dysfunction is at an all-time high. Chronic fatigue is rising. So why I'm showing you this is that this chicken or the egg scenario, right? Is it all these things impacting my breathing, or is it breathing impacting all these things? We cannot answer that question. Like, I'm not saying I know that it is chicken or egg. We have to comprehend that this is a bidirectional relationship, right? The more stressed I get, the worse my breathing becomes. The worse my breathing becomes, the more stressed I feel. And it becomes this downward spiral for a lot of people. Like, we know there's very well-established changes to the brain and the stress response, right? When we've been under prolonged periods of stress, my respiratory rate goes up, my respiratory volume changes, right? Now my heart rate is higher, my brain waves are accelerated. That can then feed into my kind of ascribing meaning to the symptoms I'm experiencing. Oh, this is anxiety. Well, actually, maybe it's just because you're breathing 20 times a minute, because you've been under stress for so long. So we might take away the stress, but the breathing dysfunction has not changed. And that is going to perpetuate this dysregulation of a nervous system. And so why I spend so much time on the kind of corrective side of breathing rather than doing breath work is because we must correct the underlying dysfunction if we want to see a change in the outcome. To change someone's stress, anxiety, fatigue, pain, right, is not going to come from doing some blast off transformational breathwork session. It just isn't. Because the impact that chronic stress, anxiety, fatigue, these things have on breathing becomes habitual, right? Remember Wolf's Law. We get good at what we do frequently. If you're stressed all the time, you get better at breathing quickly all of the time. And we can change your stress levels, but we will not change your breathing because your brain has learnt, right, that that level of arousal is necessary for you to navigate the environment. And so it's a really kind of like tricky situation that when people don't understand what is driving the feelings of their stress and anxiety, they look to and blame the external world, right? My anxiety comes from out there. It happens to me. No, it doesn't. Right? Yes, there may be a trigger in the outside world, but it is an internally generated state, which we'll talk a little bit more about. But I just want to kind of highlight something here. This is honestly one of the most frustrating things in my world, that we continue to change what we call normal, right? If you go into medical literature and you look back and there's historical data, respiratory rate used to be 8 to 12 breaths a minute, right? By the mid to late 20th century, we're starting to see that reflected in 12 to 16 breaths a minute. If you go to a doctor today, you go into a hospital today, normal respiratory rate is 12 to 20 breaths a minute. It's bullshit. It is not normal. Just so many people have dysfunctional breathing that we're like, call it normal. It's not normal, it's common. How in the world, in the space of a couple of 100 years, has our breath rate doubled? And we've just been like, that's just natural change. It's not. We're sweeping it under the rug, right? The fact that people are breathing 15 to 20 times a minute is a reflection of the state of their nervous system, of the state of stress that they're under, right? And it is being reflected. Our breathing is like a temperature gauge. It's like we are running hot, right? But just because so many people are stressed and so many people are dysregulated, we just categorize that as normal. It's like, oh, well, everyone's coming in breathing 18 times a minute. That must be normal. It is not normal. Right? If we go even further back and we look at yogic texts, traditional pranayama, Chinese medicine, they talk about 6 to 8 breaths a minute as being optimal. How far have we come? Like that should make everyone scratch their head, right? Even if you don't have an in-depth understanding of human biology and respiratory physiology, you must understand that we've gone from, say, 6 to 8 breaths a minute as being ideal when the world was very different to 15, 20 breaths a minute. Well, look at the world today, right? Like our breathing isn't optimal. It is dysfunctional and it is serving as a signal or an indicator that my state is disrupted, right? My lifestyle, my behavior, my habits, all these things are causing this disruption in my breathing, which we can measure, right? We can measure that of an elevated respiratory rate. There's actually a terrifying statistic that I'll just quickly share that post-heart attack, right? For those of you that do work clinically, post-heart attack, a 4 breath per minute increase in respiratory rate predicts death in the next 3 years. So 2 people have a heart attack, right? Patient number 1 breathes 15 times a minute. Patient number 2 breathes 19 times a minute. Patient number 2 is exponentially more likely to die in the next 3 years. I used to work in cardiac rehab, and do you know what I was not teaching anybody? Breathing, because it was not taught to me, right? We're not teaching post-heart attack cardiac failure patients about lowering their respiratory rate. It's not there. And I used to be a cardiac respiratory physiotherapist. So where's this information coming from, right? Like who is it that we can rely on to teach people, hey, if you don't bring your respiratory rate down, it's going to cause early mortality. Like this is why I want this workshop, and I'm so grateful that you're all here, is because we can start to get this information out there. It's like, oh, it really matters, right, how I'm breathing, and there are things that I can do that are zero cost interventions that are going to improve my breathing, which therefore is going to improve the state of my nervous system, my physiology, my health, right? Like health is not the absence of disease. We have to support the innate capacity of the body to generate health. So just because something is common, we shouldn't call it normal, right? Normal is having 2 to 3 chronic diseases if you're an adult in the US population. Normal is being on 3 to 5 medications, right? Normal is being obese. So let's not strive for normal. It's normal is fine if we're comparing it to abnormal, but if normal, right, amidst this chaos that is the modern world, is not something we should be striving for. So normal is a really scary word. Oh, you got a normal respiratory rate. Oh, your blood sugars are normal. Oh, it's like that should make us question, what are we calling normal? Because as we're seeing with respiratory rate, we just change the goalposts. And what used to be normal, right, isn't anymore. And so the more we continue to change that measurement, the less we're going to notice, hey, there's a big, big problem here that we're not addressing because we keep just shifting the goalposts. So the two big drivers that I see, right, on a daily basis as a clinician is the way people hold and move their body impacts their breathing, and their lifestyle impacts their breathing. And both of those things become, right, self-perpetuating. My posture can change my breathing, and then I learn bad breathing habits, cause me to continue having bad posture, right? My chronic stress and my lifestyle changes my breathing, but then my breathing drives chronic states of stress and anxiety. And so understanding that that's our kind of way in. So the second thing I kind of wanted to just like talk about is like, how does dysfunctional breathing show up? So we've touched a little bit on the causes, and I just want everyone to take a moment to kind of comprehend and be like, okay, so if I go out in the big bad world and I'm looking at this, like, am I able to recognize why dysfunctional breathing is so prevalent? Yeah, look at all those people with their head down in their lap sitting on their phone all day, right? Look at how long people are sitting all day. Look at how much stress people are under. That is going to impact breathing. But how do we recognize it, and how do we help other people recognize that breathing is a problem? Anyone know what the most common mental health issue in the world is today? You can throw it in the chat if you want to have a guess. You got about 2 seconds before I change the slide. Christoph, well done. Anxiety. I have a big issue with the term mental health, right? Anxiety is not a mental health issue. It is a health issue, right? The basis of a lot of what we call anxiety is physiological, right? It is not happening in my head, okay? So this term of mental health really, it sets people up for failure, right? Instead of helping them address lifestyle factors, right, and things that influence their physiology, we're looking for an imbalance in my brain, and so I really disagree with the term mental health. Yes, most people experience it perhaps as a mental state, right? My thoughts are racing, I'm catastrophizing. But if you ask enough people, describe to me anxiety, a lot of people will describe to you physiology. My heart pounds, I get tense, I get clammy, I get sweaty, right? There's a feeling of constriction on my chest, I can't breathe. These aren't mental states, they're physiological states. So if we continue to call anxiety a mental health issue, we will continue to look for mental health strategies, and we will fail to recognize the driver as perhaps physiology. Why I'm showing you this pretty scary, complex looking image of a brain, right, is the pre-Botzinger complex, this little red section down here. I don't know if you can see my mouse, hopefully you can. This is essentially the generation of my breathing. And look at all these links, right? So the vagus nerve comes in and sends signals to the pre-Botzinger complex. It sends signals to the hippocampus, right, which is my memory, to the amygdala, which is my threat detection, to the prefrontal cortex, which is my cognition. And so breathing is not breathing, right? Breathing is brain regulation. And when we see the impacts that this area of my brain that controls breathing has all of these little tendrils that shoot out into the rest of the brain and the body, it's like, oh yeah, again, this seems like it's pretty important. So why aren't we talking about it? Again, as someone that went through 5 years of secondary education to become a physical therapist, we didn't talk about breathing. I have a lot of doctors that come through our training program, they weren't taught about breathing outside of very specific pathology. Oh, someone's got emphysema or they got COPD, right? We're not talking about function and health and performance and how we optimize this thing that literally keeps us alive. Again, the pitfalls of the modern medical system is it's reactive. Wait until someone has a disease, dysfunction, and then scramble to try and correct it and manage the symptoms that come with it. Instead of teaching people preventative strategies, right? If we can teach people how to use their breath to change their stress response, to change their anxiety, then downstream of that, we're going to come up against a lot less issues. Breathing is intimately, right? Intimately tied to our experience of fear, anxiety, and panic. Some pretty new research coming out that shows the part of the brain, right, responsible for stopping and starting breathing, right, can be activated, right? So our breathing can be inhibited when we feel fear, when we feel anxiety. And the tricky thing as humans is we can generate fear and anxiety about something that's happening in the future right now, just by thinking about it, right? Yesterday, I was thinking about this webinar and I got a little bit anxious, right? Because I'm like, I really want this to go well. I've got a lot to share, right? It's not an immediate threat. It's not even a threat, but the way that our brain is designed, right, is going to change my physiology in anticipation of the thing that's coming in the future. Right? I work with so many clients that have, anxiety around going to the doctor, right? The week before they're even at the doctor, their physiology is interrupted. Their nervous system is changing state because thinking, right, can drive this change in my breathing. My psychology can impact my physiology and vice versa. So I want everyone just to kind of take away that when we look at things like stress, anxiety, fear, apprehension, overwhelm, these aren't independent. This is not this reductionist, those things just happen in our head, right? Or those things are just emotions. There's an interplay between my breathing, my physiology, and my emotional experience and my mental state, right? So it's really important to understand that kind of like the relationship again, rather than just isolated systems that don't talk to each other. That's very old science, right? It's very reductionist, and that's not how human health works. I just want to share very quickly a study that was kind of shown this isn't just about panic, this is more about interoception, right? Interoception being my awareness of my internal state. They did a study where they took people that have out of the blue panic attacks, right? I just had a panic attack, it just happened. And they put them on these Holter monitors that would measure their physiology, right, on a minute by minute basis, 24 hours a day. When they had this out of the blue panic attack, they pressed this button, right? And this button took a snapshot of the previous 60 minutes of data. And then they compared that with asking the person, so like, what was going on before you had the panic attack? Nothing, right? It was just, I was carrying on and then bang, panic attack. Then they look at the data. An hour before the person had the panic attack, there was a change in their respiratory rate, right? There was a change in their respiratory volume. There was a change in their autonomic arousal. All of these things that we, if we're attuned to, can notice. The point I'm trying to make here is that things don't happen at a random occurrence in the body. But if you've habitually dissociated from your body, right? If you've habitually turned away, or you look at your anxiety as a punishment or a pathology rather than a prompt, right? Then you fail to recognize the signals from your body saying, hey, we're veering off course. And if we don't do something about it, things are going to get worse, right? Panic attack is really when we cross a threshold, right? It's the proverbial straw that broke the camel's back. There was underlying changes that were occurring an hour before that person didn't notice. Most of those changes were occurring in breathing. And so many people are so disconnected from their breath that they didn't notice. I just started breathing faster. I just started breathing shallow. I started holding my breath, right? Breath holding is so common when I work with clients and they're like, oh, I noticed, right? Like how often I hold my breath now that you've got me to pay attention to it. Every time I'm focusing, every time I'm listening to something, every time I'm really trying, it's like I stop breathing. Well, if we come back to this slide, I don't know if I can go backwards actually. Oh yeah, I can. If we come back here, right, this change or this stop in my breathing stimulates a fear response in my brain. So I could think of something, my breath stops, I don't know it, there's a change in my physiology, my brain responds to that by provoking anxiety, and it's like all of a sudden I'm just anxious. And I'm wondering what happened, why am I anxious? It must be something out there. Actually, you didn't notice that you just hold your breath, right? And you changed your own chemistry, and then your brain responded to that change in chemistry by generating a very appropriate state, anxiety. Anxiety is designed to get you to change your environment, to get you to move, to get you to take action, right? Anxiety is not a mistake that our body makes. It is a prompt telling you that there is a dysregulation that's occurring that we need to change, right? That we need to respond to. So I love the end of this research basically said, right? This research opens doors for developing new therapies that focus on detecting and addressing the physiological changes, right, of anxiety and panic before an attack occurs. What this is, allow me to paraphrase, right? People need to become more aware of their breathing, right? Detecting and addressing the physiological changes. That is occurring when I notice that my breathing changes. That is what we're talking about here. Yet, most people are completely unaware of their breathing 99% of the time, right? I really, truly believe we should teach everybody breath awareness, right? What does the change in my breath signal to me about what's happening in my body? We should then teach people breath control, right? So I'm feeling anxious. What can I do with my breath to reduce that anxiety? I'm feeling tired. What can I do to pick up my energy? And then finally, we should talk about breath optimization, right? And that's really increasing our resilience, our capacity. So many, right, when we look at breath work, is jumping to optimization, right? Get people in a room and hyperventilate for half an hour. That's not what people need. The vast majority of people don't need that. In fact, that is going to make the vast majority of people worse. Why? Because you're teaching them to hyperventilate, and half of their issue is hyperventilation. Like, that doesn't make any sense to go and do the thing that's actually causing the dysregulation. Let's just practice more of that for 30 minutes every day, right? We should be teaching people awareness. What is this language, right, that my breath is speaking? How can I start to interpret that and understand what these changes in my breath mean and signal about what's happening to my internal state? How can I begin to control my breath? If I hold my breath when I'm anxious, what can I do about that, right? Finally, once we've built that foundation of optimal breathing, yes, we can start to do the cool, shiny tricks, right? Which is like experiential breath work. And this is not to say, like, there is such potent power in intentional breath work. It can really be cathartic and it can be incredible, but it doesn't negate the need to ensure that someone's breathing in a way that supports their body. And that's what I get a little frustrated about, coming from a background that I have and seeing the popularity of breath work, which I think is incredible. And I'm so happy to see that. But most of what is being taught actually worsens the problem, right? Because it's like, go and breathe up into your chest hard and fast with your mouth for 30 minutes. And that's the exact dysfunction that we're seeing 24 hours a day, right? The better I'm able to optimize my breath, the more I can use it with intention, right? There is nothing wrong with breathing through your mouth if it's intentional, right? But habitual, unconscious mouth breathing is pretty catastrophic in terms of the impact that it has on the brain, on the body, on our physiology. So it's not to say these black and white rules of good or bad. It's to really understand how and why I'm using my breath. And do I have control over it? Or is it changing in response to the environment and I'm completely unaware of it? The kind of third and final aspect that I wanted to talk about today, and I've got about 10 minutes to do it. And I could speak about this for a couple of weeks, honestly. So we've gone from like, how does posture impact breathing? How does breathing impact our physiology when we look at things like fear, anxiety? And how do these things show up as our state, right? This is where we talk about the nervous system, right? I just like to use the term state as this kind of snapshot of like, how am I feeling right now, right? Tired, anxious, stressed, grateful, excited. These are all states that we can experience. I teach the nervous system a little bit differently to most, right? Most people are taught the nervous system as a binary, sympathetic or parasympathetic, right? It's black or white, it's one or the other. Really what we need to be looking at the nervous system is more like a spectrum, right? We can be between sympathetic and parasympathetic. We can move between those 2 points on a scale. So it's not that there's just this switch that we flip and I went from full-blown stress response to calm Zen monk, right? I have to work my way between those 2 points. And so much of the language that's used around the sympathetic, the fight or flight, make people think there's this switch that they got to flick, right? I've just got to get out of the stress response. No, you have to work your way down that spectrum, right? And you need to be able to work your way up that spectrum when the environment or the situation calls for it. So this is not about taking away someone's sympathetic state, right? It's about having more influence over how quickly I return to baseline, how quickly I can shift out of that stress response. Because what everyone should understand is the way that the stress response works, right? We see something scary. We always get given the example of like the tiger comes out of the bushes, but this could be a car drives too close to you. This could be anything that's happening in terms of a social context, a physical, an emotional, right? A threat. This leads us into that sympathetic state. So we move up the spectrum towards the sympathetic end, right? We're not just in a sympathetic state, we're moving up that spectrum. What does that lead to, right? That leads to changes in what my nervous system is prioritizing. Really important concept to understand here, prioritization. Based on the state that I'm in, my nervous system will choose to prioritize certain functions over others, right? When I'm in a stress response, the priority is action and survival. Blood flow to my limbs, constrict my digestive tract, dilate my pupils, send blood flow out to the limbs so I can run away or I can fight. But that also means I have to deprioritize my immune system, my cellular repair, my digestion, my inflammation management, right? We can't do two things at once. There's an allocation of resources. Based on the state that I'm in, my nervous system, the most complex piece of machinery in the known universe is deciding, what do I shut down? What do I start? What do I move some energy over here? What resources do I allocate? But if we come back to the fact that more people are stressed than they ever have been, more people are more anxious than they ever have been, this impacts the nervous system. So people are stuck in this state where they're not prioritizing recovery, repair, restoration. And we see the rates of chronic disease at never higher rates, right? So much of it comes because people are in the wrong state. What's really important is your brain doesn't differentiate between the tiger chasing you and the email from your boss, right? Or you're running away from a threat, or there's a deadline, or you got bills to pay. You know, the tricky part with, right, the modern world that we live in is so many of the threats are now not physical, right? No one has to go and fight tigers anymore, right? We used to, they used to be predators, but we all have to deal with social, right? Isolation. What if I say something that someone laughs at me, right? This survival network in my brain, right, sees being cast out socially as death, right? Because that's what it used to mean. You got kicked out of the tribe, you didn't survive very long. And so this constant comparison of other people in the world because of social media and what does media tell us about all of the dangerous stuff that's happening? So like we're bombarded with information that puts us into a sympathetic state. Yet we're sedentary, more sedentary than we ever have been. And so you start to see this like seesaw really begins to swing, where it's like we've got all of this chemistry and physiology that's designed to get me to fight and run away, yet I'm sat in a chair for 8 hours a day. That is not sustainable. And we're seeing the evidence of that with how poor people's health is today, right? Health, life, like prediction of life is going down. We're living shorter now. Like, yet we have all of the wonders of modern medicine, right? We're not living longer, we're staying sick longer, right? It's a very big difference. And to understand that, it really helps us think of like, well, what do we do instead? So if we think about the nervous system as this determining factor on like what's going on in the world, what someone does is less important than the state they're in while they're doing it. I work with a lot of people that come to me for stress and anxiety and panic, and it turns out they got a lot of digestive issues. And they've done all this food sensitivity testing, for example, right? I'm reacting to all these different foods. I'm so sensitive to certain foods. Is it the food they're eating, or is it the state that they're in while they're eating? It's a really different question to ask. And anecdotally, like the clients that I work with, when I teach them how to regulate their nervous system and how to shift into that parasympathetic state before they eat, lo and behold, their bloating and their digestive distress and their IBS went away. They weren't reacting to foods, they were reacting to food because they were not in a digestive state, right? If you eat whilst you're replying to emails and you got your laptop open and you're talking to your kid, it's like you're in that state of action. There is no blood flow in your digestive tract. You haven't secreted digestive enzymes. You haven't secreted salivary enzymes, right? Your nervous system is not prepared for food, so it's not going to prioritize it. Bang, in there goes the food, and it has this massive swing on the body. This is just an example, but this is true of the way we exercise, right? Like if someone goes and just smashes themselves and their mouth breathing, it's like, my brain's not like, oh, this is exercise. My brain's like, I've been running away from a tiger for the last 30 minutes. On top of the chronic stress that I'm facing at work, my financial woes, my relationship, it's like, why is going and doing something more stressful a good option? It's not. But we fail to recognize the impact that these changes have on the state of our nervous system, right? And the fact that the nervous system controls everything else. Honestly, one of the most important things to understand about the nervous system is all it cares about is, am I safe, right? Any environment you walk into, whether it's your own house or a new environment, your nervous system is scanning the environment, right? And it is saying, am I safe? One of the primary messages that it's using to determine whether it's safe is how you breathe, right? Because what happens when you get a fright? There's a change in your breath. You hold your breath, right? So the breath becomes this really, really important messenger or information source for what my nervous system perceives about the world. And that is why breathing is so important, right? Is I can change the message. I can breathe in a way that suggests to my nervous system that the world is safe and supportive. Rather than what's happening for a lot of people, because of posture, because of lifestyle, because of chronic stress, my breathing is continually telling my nervous system the world is scary. Right? We need to be ready to run away or to fight back at any moment because of all of this bombardment of information. And so even when someone relaxes on the couch, right, their breathing is still suggesting that they might need to be ready to run away because it's shallow and it's dominant in their chest, right? Because they sit at a desk every day. Like we start to see this really like insidious cycle that happens. So remembering that your breathing is always informing your nervous system is hugely important, right? And you, again, you already know this. What happens when you feel anxious? Your breathing changes, right? What happens when you feel tired? Your breathing changes. When you feel energized, your breathing changes. This is this interplay between my state and my breath. And so I just kind of discovered this for my own personal interest. 7, 8 years ago, I heard about this guy called Wim Hof climbing mountains in the snow, and I flew to the Netherlands and I went and trained with him and I did some cool, crazy stuff. But I realized that when I took that and I started to actually work with people's breathing, right, and I started to treat dysfunction, I recognized that when people breathe better, they feel better. And that's a very big, broad generalization. But when people feel better, they start to usually get better. They change the decisions, their behaviors, their actions, how they're showing up in the world. And so I always like to kind of see breath as this kind of like domino, right? We push over this first domino, which is the restoration of breathing. And that starts to change my physiology, my nervous system, my emotional state, whether I want to exercise, whether I'm sleeping well, how I'm communicating. It's like these secondary, tertiary, like 3, 4, 5 steps down the line, we're seeing these changes that have really been put in motion because we've actually helped someone correct the most foundational aspect of their health, right? The one thing that actually keeps us alive, right? It's pretty important. And when it's not working well, we see that in the body show up, as we've discussed today, as anxiety or panic or pain or fatigue, right? It's not showing up as like, oh, I've got bad breathing, right? The body's pretty resilient and it can cope with a lot, but there are signs and signals. And if we know what to look for, then we're a little bit more informed about what we can do. We're going to have time for questions. As I mentioned, I'm just going to spend a couple of minutes, if everyone's okay with it, just sharing a little bit about kind of the program that we teach and why we teach it. For me, honestly, breathwork has changed a lot over the years in terms of what I learned, in terms of like the Wim Hof method and running workshops and, breathwork versus what I've found to be what actually moves the needle for a lot of the clients that I work with. And we've worked with hundreds of health practitioners now to kind of incorporate breathing, and we get a lot of the same stories back, right? Whether you're a massage therapist, a doctor, a dentist, a health coach, a yoga teacher, are your clients breathing? Yes. Are they breathing well? Well, that's a different question. And hopefully, again, what you've taken from today is to be able to identify, oh, you engage in these things that maybe disrupt your breathing. Oh, you've told me about how much stress you're under. How does that show up in your breathing? You struggle with anxiety. Is there a physiological component to that? And so, I can't in 45 minutes or an hour explain all the ins and outs of breathwork. It usually takes a couple of months, which is why we have the training program that we do. So I just wanted to kind of very briefly share where people can go and why we teach what we teach. So I'll pop a link in the chat in a moment once I just kind of finish this slideshow, just to show you a little bit more in depth. But the program we runs for 3 months. We next start in January. We have small cohorts. We are running kind of a special offer over the next 5 days just for people that have joined this webinar, where we're giving a little bit of a discount and adding in a couple of important bonuses. And so, yes, I hope, right? And I'm going to sit and hopefully chat to you all for the next half an hour and answer some questions, and we can dive into specific tools. But I always encourage people to ask themselves this question, right? Like, if your patient on Monday is like, I'm really struggling with anxiety, do you send them to the psychiatrist or can you help them? Someone saying I'm really struggling with fatigue. It's like, do you have to go to the nutritionist or can you help them? A lot of this comes back to informing someone's nervous system. And a lot of that comes back to breathing. And so we really try and teach breathwork through these kind of 3 pillars or these 3 steps. The first is understanding breathing, not breathwork, right? Breathing, this foundation of health. So trying to really understand how to assess and treat breath, right? The second phase is using breathwork. There's all these different tools. Once you understand the underlying mechanism, you can begin to apply tools, right, and personalize an approach to the individual. I really like to teach what I term outcome-based breathwork. Rather than one size fits all, everyone does breathwork. What is the outcome that you're looking for? That should determine what type of breathing we use. There's not a one size fits all approach, right? Everyone's breath is as unique as their fingerprint. It's a reflection of their nervous system, of their life, And so understanding what someone wants. Are you trying to reduce your anxiety? Are you trying to increase your energy? Are you trying to regulate your emotions, have more, that should determine, okay, well, this is what we need to change or correct about your breathing. And then the third phase is kind of sharing breath work, right? And this taps more into like, how can breath work be used as a modality, right? And how can you get in front of people that need your help? So we talk a little bit more about the positioning in terms of who's the person you want to help, what is the problem that they have, what is the promise that you can deliver in terms of like how you position what breathwork is. Because I know, because I've asked this to thousands of people, what most people think breathwork is, right, is a bunch of people laying in a room hyperventilating, maybe some tears, maybe some emotional release. That's not what we've spoken about today, right? There is a slice of breathwork, but it really, in the grand scheme of things, in terms of what changes people's health, that's not the thing. It can, as I mentioned, right, open up this doorway and it can be the catalyst. But without the correction and restoration of breathing, we're not going to be able to push back against these huge lifestyle influences, these postural influences, these environmental influences that are messing up people's breathing. And so that's why we kind of teach the program we teach. Again, I'll just drop a link if you want more information. But just for the next 5 days, so the program is $4,100. We've got a $300 discount that's open for the next 5 days. And we're just adding in a couple of bonuses. So we have an additional month of kind of supported integration at the back end of the program. Let's get this up and running with you and for you. We present case studies. And so I've got a backlog of case studies. Like, let's dive specifically into anxiety, panic, long COVID, right? And talk through my clinical reasoning. This is what I assess, this is what I treated. So I'm just going to share additional resources in that. And then we also do some master classes. So I've got one on the diaphragm, one on the vagus nerve, that if you do work, right, with stress, anxiety, these kind of things, and understanding of the nervous system, right, the vagus nerve, and how breathing works, the diaphragm, can be incredibly, incredibly powerful. So if you are someone that's interested in learning more, again, you know where to find me. You can send me a message. I'll pop a link as to where you can just read a little bit more about the program. My calendar's open for the next 5 days. We don't just say, hey, yeah, you can join the program. I want to have a chat. I want to know where you're at, what your goals are, why you want to pursue this. We keep groups really small. We've only got 10 people in each group. And so this webinar will go out to, I think, 170 people were signed up. We're limiting this to 10 spots. And so if you are someone that's like, yes, this seems like something that I would like to use for myself, my family, my community, my profession, then I'd love to have a chat over the next couple of days and see if this is something, that fits for both of us. But as I mentioned, I'm not going to spend too much time pitching anything. It's not for everyone. But if you are someone that this is kind of struck a chord and you're like, oh wait, I haven't really thought about it like this, then I'd love to just chat a little bit more. Those of you that know me, I'm the worst salesman. Like, this isn't like a high pressure sales call. Like, I really want to understand, is this the right fit for you, right? We have a mentorship program, so you can kind of come without the, oh, am I going to get sold to? Like, I don't put any pressure on. If you don't want to do the program, that's no skin off my back. I don't pressure people into it. So I've jumped on so many calls where I think it's gonna be information that it's like, I can't get off the call until I like make a decision. It's like, that won't happen. So just kind of like letting that be very, very transparent. Questions?